After suspecting that the Omicron variant of the COVID-19 virus has reached Antigua and Barbuda, health officials have now received confirmation that it in fact has. The Ministry of Health, Wellness and the Environment on Thursday said that 3 of the 25 samples sent to the Caribbean Public Health Agency, CARPHA, last month had tested positive for that relatively new, highly contagious strain of the coronavirus, that Omicron variant, first identified in South Africa last November. More transmissible, they say, than other variants of concern, but experts say it causes less severe illness. The Ministry of Health noted that after a decline in the number of COVID-19 cases since the end of the last surge in November, there has been an increase now in the number of cases. Chief Medical Officer Rhonda Seeley-Thomas says Omicron's to blame and the Twin Island nations experiencing a fresh COVID wave.
We are seeing an increase in the number of cases. We have a surge again. We know that it's due to Omicron because that's what we know is happening in other islands and other countries, other territories. So the public health and social measures, we need to continue to do those things in order to prevent the transmission, further transmission and further increase in the number of cases. I would say this is the 4th wave. The first one would have been in 2020. We had 2 waves last year in 2021. We're just coming out of a wave, and we're seeing an increase now, which will be our 4th wave. We're in the process of doing modeling in association with CARPHA and our epidemiology unit, and we anticipate that we will see an increase in the number of cases, but hopefully, as with other countries that have started their outbreaks due to Omicron, they see a very steep rise in the number of cases and then a decline. And we are hopeful that with the public health measures and the cooperation of the public, we will have a similar pattern where we will see a peak and then a decrease in the number of cases.
And much like a lot of spots around the globe, the Turks and Caicos is seeing a spike in COVID cases driven by that Omicron variant. Our One Caribbean News, DeAndre Hamilton has the latest on the case counts in TCI and what needs to be done to turn things around.
In a joint press conference to update the nation, given the surge in COVID-19 cases, National Epidemiologist Dr. Shandy Malcolm confirmed the trend and offered some demographics on who was contracting the coronavirus. At the time of the update, which was just before the new year, Turks and Caicos had recorded 184 new cases. In November, 117 and 123 new cases were recorded in October.
That on December 24th, as many as 41 new cases were detected. This is the highest number of single-day new cases we've seen in a while, specifically since early February of this year.
She added that the increases in cases is as a result of what is happening in the world. The U.S. and the U.K. alike recorded their highest COVID-19 cases in recent days.
While these numbers are partly due to a lag in testing caused by the holiday season, they are also attributed to the new Omicron strain that has quickly taken hold throughout the world.
Dr. Malcolm said that of the 184 cases recorded in December, about 63% were visitors, which means they were breakthrough infections since visitors to the Turks and Caicos Islands have to be fully vaccinated.
That visitors are testing far more than we are, since for many, a negative test or proof of recovery is a requirement for travel. It could be that we are finding more in this group only because we are looking more in this group. The truth is, it is difficult for us to know what exactly is happening in our resident population because we are not testing.
The Minister of Health, Jamel Robinson, added that community testing is one of the areas where the Turks and Caicos Islands falls short. The other is the booster program. He also announced the Ministry of Health's COVID-19 free testing program in Grand Turk, Providenciales, North, South, and Middle Caicos. When testing opened on Tuesday, this is what it looked like in Providenciales.
In Brazil, the annual Carnival celebration is coming up next month, but this latest wave of COVID cases means things are going to look a little bit different this year. Here's more on where the parties will and won't be for Carnival.
The city of Rio de Janeiro has announced it was cancelling some of its world-famous Carnival events due to a surge in COVID-19 cases. The mayor, speaking to journalists, explained that while the most iconic events of them all, which is the Samba Parade, will go ahead as planned inside a stadium, street parades will be cancelled instead. Here is the mayor speaking with CNN Brazil.
Ele é carnaval que você não consegue estabelecer nenhum tipo de controle sanitário.
In street carnivals, you don't get to establish any kind of health control. That's just how they are here in Rio. It's a street carnival that has a lot to do with the territory where the blocks get out. I'm going to make a comparison. It is the Samba Stadium. The same way you have health controls that you can impose in football stadiums, you can also establish the same controls at the Samba Stadium.
The mayor's decision is emblematic of the tight rope that authorities in South America are walking as they try to limit the spread of the Omicron variant without imposing new lockdowns that could hurt their economies. On Tuesday, Brazil reported more than 25,000 new COVID-19 cases and 129 new deaths attributable to the virus. Other countries, such as Colombia and Argentina, are also experiencing new spikes in COVID-19 cases, with Argentina's situation the one causing most concern. But just like in many other parts of the world, a rise in new COVID-19 cases is not immediately translating into a rise in deaths and hospitalizations.
Well, despite the pandemic and that spike in those COVID cases we're seeing around the globe, as well as in the Caribbean region, tourists continue to make their way into the Caribbean. The same thing's happening at other tourist destinations like Mexico. Hundreds of people flocking into Cancun, the Mayan Riviera, during the festive season in Mexico, all despite the recent increases in COVID cases. Cancun and the Riviera Maya seeing those spikes, and with Mexico about to enter a fourth pandemic wave, it doesn't seem tourists have been scared off. Many say they feel safe on the beach with fresh air and social distance. In Cancun, various COVID-19 testing stations have been set up at some of the major beaches, hotels, and airports. That's the spot are spots where tourists can be tested for COVID-19 in order to enter the country of origin.
Not taking too many precautions, honestly, but it's been beautiful out here. It's incredible, and it's great being able to come out here at these times.
All the necessary tests that you have to take up front before coming here, all the checks on the airports and all the various transit areas, all the COVID checks, the constant wearing of masks. So that was quite different. And coming here, I quite feel safe on the beach with the fresh air. Masks not really that necessary, but still always concerned about getting the virus.
Elsewhere, residents of the Morro de Formiga Favela on Thursday marked a Three Kings Day religious celebration in some colorful costumes, along with some music blending Afro-Brazilian culture with the traditional Catholic symbols of that annual religious holiday. The Bright Star of Bethlehem is a King's Revelry group that focuses on passing the folklore culture to the children of the Morro de Formiga community, a tradition that's been present for more than 80 years in the favela. Although having a parade full of revelry and dancers scaring young children, the groups are actually based on devotion, solidarity, discipline, and union. The Epiphany, of course, celebrated annually on January 6th, marks the biblical journey of the three kings to visit the baby Jesus.